So today I wanted to talk about my second diagnosis, which is known as stiff person syndrome. So you guys have heard me mention this in my other videos, and I don't know why I haven't made this video yet. I think I have a lot of feelings about this diagnosis, and I just wasn't ready to talk about it. But because I mention it so much in my other videos, I felt that it would probably be a good idea to talk about it. That way, you know what I'm referring to when I say a rare autoimmune illness. Um, so, I guess I'll just tell the story of how I eventually got to this diagnosis. Um, some of you may know I was diagnosed with Lyme disease back in, I think it was 2011 or 2012. So it's been about a decade. I've been suffering with symptoms far longer than that, um, but an official diagnosis of that has only been for about a decade. Um, I was diagnosed officially with SPS at the end of 2018. um, so the way that I got to the Lyme diagnosis, I was actually told by a physical therapist that she suspected that I could have Lyme because my story sounded very similar to a lot of her other patients um, that had Lyme. The doctor that I currently see, or that I started seeing for the Lyme diagnosis, was referring her patients over to this physical therapy clinic, and I somehow found them before I found the doctor, so it kind of went backwards. And my physical therapist kept telling me, she's like, your story sounds really familiar, sort of like not the symptoms themselves, but just the trajectory of having a bunch of different medical issues that seemed unrelated, but all came down to a common diagnosis. I refused to believe that I had Lyme disease. I never believed I had Lyme disease. I still, to this day, do not feel that my issues are, or my primary issues are Lyme disease related. I just cannot believe it because my symptoms are so different from the typical Lyme symptoms, which are like joint pain, fatigue, headaches, fibromyalgia type pain. I never had those, or I never had them as severely as other Lyme patients. I've gone to Lyme disease support groups, and I was always the oddball in the group because my symptoms were so, some of them were so extreme, like the light sensitivity. I know that that's, seen as a Lyme disease symptom, but my light sensitivity was so severe, and I've yet to meet anybody else that has the same type of light sensitivity. I was just always looked at as very strange, like an outlier whenever I would go to these support groups. And so I just stopped going. And I just wasn't convinced. Um, the sad part is that once you receive a diagnosis of Lyme disease, doctors just refuse to believe that you have anything else. And I think that's a huge, huge mistake because um, there are some people that believe Lyme disease can trigger other autoimmune conditions. Um, I believe that there are certain genetic factors, at play that make you susceptible to, having a complicated case of Lyme disease, but also developing an autoimmune illness. So I think there's just too many variables to keep ruling out the possibility of an autoimmune condition, even if you have a previous diagnosis of something else. And there's also a lot of evidence showing that once you get diagnosed with one condition, um, other conditions are more likely. So you'll see that a lot with lupus. A lot of people with lupus will develop like Sjogren's. They'll develop immune deficiencies. They develop all kinds of different things, and it's almost like a domino effect. And I think that that's very similar with Lyme disease or, any other kind of infection that you can have. There's a lot of different theories out there. So when I failed antibiotic therapy, I never believed that antibiotics were going to help me. I could tell in my body that this did not feel like an infection. What I had did not feel like an infection. I still went through with the 6 months of intravenous antibiotics, was worse at the end of it. And then my doctor put me on something called IVIG, which is intravenous immunoglobulin. It's typically used for people that have really bad immune systems in order to bring their immune system up to normal so they can fight infection. It is also used for some autoimmune illnesses, which I did not know at the time. So this was, I think, mid 2013 to mid 2014. The doctor puts me on IVIG. I never asked any questions. I didn't know what it was. I didn't know what it did. I didn't know what it was for. I have a doctor she's very, very good, but she's very discreet, does not talk a lot about, the specifics of certain treatments, and just, I don't know, she just doesn't get into it. And she said, we need to put you on this medication to get you out of this hole. I was severely underweight. My symptoms had gotten worse from the antibiotic treatment. And obviously I was not, my symptoms had not gone away. So one of the symptoms that I have, speaking of symptoms, one of the symptoms that I have, and it's one of my earliest symptoms, is muscle stiffness. My muscle stiffness tends to be asymmetrical. I have stiffness in my pelvic floor, which my physical therapists have confirmed. It's worse on the left than on the right. I have stiffness in my trunk, which is worse on the right than it is on the left. And then I have my light sensitivity, which is also asymmetrical. It's worse on the right than the left. And I suspect that it could be some type of neuromuscular situation, but I mean, it's still a mystery at this point. So the doctor puts me on IVIG. I have a nurse coming to my home once a month, and I believe we started at 20 grams. From the very first infusion, my muscles responded. They reacted to the drug. My muscles had not reacted to anything else really during the course of my illness like they reacted to this drug. I immediately felt twitching, movement, sort of like the muscles were like opening and closing and opening and closing. I mean, I immediately felt something going on, and it was really weird. I mean, it was horrible when I developed those symptoms. It was terrifying. But after so many years, you sort of make peace with it and you think, well, this is just my body. I don't know what it is, but this is just the way that it's going to be. So to have the muscles react for the first time in years was, I mean, it was just, it wasn't scary, but it was just unsettling. And so that became a moment that was essentially burned into my memory because it was so big to me because my muscles had just gone into this stiff place and never got out of it. Now, they didn't recuperate. They did have that momentary response, which was, exciting in the moment, but they kind of went back to how they were. And slowly over that year from 2013 to 2014 that I was on IVIG, I did notice that the muscles weren't as tight as they had been. I didn't go back to how I was before I developed this condition, but I was certainly in a better place. I had also gained weight, enough weight. I was actually heavier than I am right now. And so that a lot of things that happened on this drug were just positive. I was moving in the right direction, although I wasn't sure if I would be like cured or anything. Unfortunately, in 2014, my husband lost his job. My then husband lost his job. I lost my insurance. I lost my medication. And this would begin, a 4-year journey of discovery that, I mean, I nearly lost my mind during this time because once I was off of the drug, all of the improvement that I had gained during the year, I lost it within 3 months. So the improved muscle stiffness, the weight gain, improvement in my skin, all of those things I lost within a span of 3 months. It took a year to get all of that and 3 months to lose it. And I hadn't, because a lot of the changes are very subtle, I hadn't given the medication that much credit. And so I basically was like, well, I guess it's not that big of a deal. And after 3 months, I was like, that medication was helping me. I was stable for a couple of years, so probably until 2016, and then I started to decline more rapidly. And that's when I really started, putting the pedal to the metal, and I said, I really have to, I have to get back on this drug. What I didn't know was that it's extremely difficult. This is a drug that is incredibly expensive. 1 year, that 1 year that I was on the drug was about $30,000 paid out from the insurance. So, insurance companies are going to do whatever they can to deny you because it's incredibly expensive. I ended up having a big problem with my doctor, and we ended up having a falling out, and I stopped seeing her for a couple of years. And during that time, I decided to pursue this medication on my own. It was totally crazy. Yeah, I think because I didn't know how difficult it was to get this medication, I went into it blindly. I thought, she was able to prescribe it so easily for me. This can't be that hard. Over the years, I discovered it's a drug that doctors do not want to talk about. They do not want to hear it. They know how difficult it is to prescribe, and there are very, very limited number of diagnoses that you can use to get this drug. Very limited. And you still have to fight with insurance companies, and doctors just, they don't have the time or the patience, or they just don't care. So I began researching. I knew that it was going to take a lot more work. After a couple of years, I was like, this is going to take a lot more work. I wanted to understand why doctors would turn pale when I would mention this drug. And so I started researching it, and I started Googling it. I started Googling what it was for, every possible diagnosis that I could find. And it did take a while for me to come across stiff person syndrome, which is a rare autoimmune condition. It affects a rare condition is it's considered rare if it affects about 1 in 1 million people or less. So that's the criteria, and stiff person syndrome is considered a rare condition. So I guess somehow I came across it and I started reading about it, and it talks about muscle stiffness. Now I'm not a typical case because, I don't think there really is a typical case, but the typical case it's described, they say that it affects your limbs, so your arms and your legs and the trunk. But typically it's arms and legs, and it causes painful spasms. So you basically have these incredibly painful muscle spasms in your arms and legs, and it makes it very difficult to function. It makes walking difficult. Obviously, it's incredibly painful, and it's a very disabling condition depending on your severity. I do think it varies, though, from person to person. My stiffness came on and never went away. For some people, it's almost like a relapsing, remitting type of thing where they'll have the stiffness or the spasms, and then it'll stop, and it'll kind of relax for a while, and then they'll have another attack. But it seems like there are different forms. Similar to multiple sclerosis, where there are different forms of multiple sclerosis. There's very, very mild to very severe, disabling, even deadly. And it's very similar with stiff person syndrome. The muscle stiffness, the one thing that stood out to me, that I think the thing that convinced me that this was the diagnosis that I had, was that the muscle stiffness is typically asymmetrical. So your right side, like your right arm will be affected, but not your left, or your left leg will be affected, but not your right. One side of your trunk muscles will be affected more than the other side. And I knew from going to physical therapy, my physical therapist had told me, they're like, it looks like you're kind of pulled to one side, which means one side is worse than the other. And I had the same thing with my pelvic floor. When the doctors or the physical therapists would feel the muscles of the pelvic floor, it was always the right side that was the problem. And they seemed to have a very difficult time making progress and getting the muscles of the left side to just let go and relax. And also, eventually, after a while, I actually had one physical therapist ask me if my light sensitivity was worse on the right than it was on the left. And I was like, yeah, like how could you possibly know that? That's a brain issue. But I think from just her feeling the muscles and the feeling the difference in the muscles on the right side of my neck and my head, because there are muscles in your head and neck, there was some kind of difference that she was feeling. And these were very, very highly skilled physical therapists. I wasn't just going to I was paying out of pocket. So it was costing me a lot, but I was getting the best of the best that I could afford. So I trust my physical therapists a lot. And so I trusted her when she told me that I probably had Lyme disease. And even though my gut was telling me there's something else going on. So it took quite some time. I was getting really desperate. I was seeing a therapist at the time that was just not helping me. And so I decided I was going to look for another therapist. And I went and I saw this therapist that actually wasn't too far from where I live. And I told her, I said, look, this is what I'm going through right now. I said, I know that I'm sick. We know that already. That's been established. There's something going on in my body. I had already tested, I had a positive ANA, which means that you have some autoimmune activity in your body. And of course, the Lyme disease thing and, blood work. There was something going on. We already established that. But I told her, I said, look, I suspect, and I know she's a therapist, but I told her, I said, I suspect that I have this other condition and I'm not getting anywhere. And I have doctors telling me all over again that I'm crazy, even though I'm showing things on blood work. These doctors can no longer give me that excuse. And she said, I agree with you. She said, I know a doctor. She had stopped practicing for a while. She's now practicing again. She's right here. She was in the network, my network of insurance. She said, she's right here. Why don't you go see her? She was a female doctor. She was a woman. And she was a bit of an older lady. But I said, at this point, I need a new primary care. I had stopped seeing my Lyme literate doctor. I need a doctor. And I went and I saw her. I told her everything. She asked me, are you seeing a therapist? And I said, yes. As a matter of fact, I was referred to you by a therapist. And I think that was the moment where this doctor was like, this person is sick. She already spoke to a therapist and the therapist sent her to a doctor. That's what I needed, was that for a therapist to say, you need to see a doctor. You need to find an answer to this. So the story's kind of dragging on a bit, but this doctor said, you need to see a neurologist based on what you're telling me. She said, I don't know what you have, but I'm going to send you to someone who might. And you need a neurologist that's a little bit older, that has seen a lot more than a neurologist that's just been practicing for a few years, because I had seen some neurologists that were rather young. So she sent me to this guy, this gentleman in the same network, same medical network. And we were working backwards. And to me, I'm telling them this is the medication that helped me. That should make it very, very easy for them to diagnose. So I tell him this is a medication that helped me and this is how my body responded to it. And based on that, he ordered something called a paraneoplastic panel, which is essentially a blood panel to detect these specific types of conditions that there's a lot of them are related to cancer, but not exclusively. There's more to that story. If you want to know more about that story, go see my video on horrible doctors. But eventually, I had already had one opinion from one neurologist at a university. And this doctor said, we need a tiebreaker. He says, because I think you may have this, but it's 1 against 1. So he sent me to UCLA to see another neurologist there. And she said, I think you have stiff person syndrome. And there was other issues going on after that. I mean, there was a whole mess that happened, but she was essentially the tiebreaker opinion. My blood work came back negative for the antibodies, which is why he wanted someone else's opinion. And my neurologist also told me, he said, UCLA is sort of this, world renowned medical school, and it's going to be a lot easier for them to get this drug prescribed to you than it would be for me. So, like I said, there was a bit of a mess there, but at this point I was like, I've gotten this far, and I'm not, I'm not going to get mad at these people. If I have to wait a few months, I'll wait a few months, but let's move forward. And eventually the doctor at UCLA got me prescribed the IVIG that eventually, that I've been on for 3 years. So, and keep in mind, this journey began in 2014 and it ended at the end of 2018. It was almost 4 years. It was actually 4 years. It was about 4 years from beginning to end till I got this drug. It's a very, very difficult drug to get prescribed, and especially if you're not showing any positive antibodies or anything like that. The only thing I had was the autoimmune, the ANA, an elevated ANA, which is an indication that I have an autoimmune condition. The good thing is that my doctors believed me, and I think it's because of that one therapist. And I actually never saw her again. I only saw her that one time. I think I saw her once or twice. And, to me, it was almost like fate. It was meant to be. But that's eventually how I got to this diagnosis. And I'm here. I'm stable. I'm not cured, but I'm better on IVIG than I am off of it. So that's the story. I may come back and make another video speaking more specifically to stiff person syndrome and the symptoms accompanied that come with it, because they can vary from person to person. But this is how difficult it is to get a diagnosis. And I believed from day one that I had something, that I had something that not a lot of people had. And that would explain why it took me close to, over 10 years to get this diagnosis, because it's a rare condition. So thank you for watching my video. Please like and subscribe, and I will see you in the next